This is an evaluation of Godfrey's Children's Center in Tanzania. My name is Victor Duguay, and I'm here with Alan Wallace, and we'd like to start by discussing our backgrounds. I was the director of the evaluation project. I have an MBA as well as an MA and PhD in human communications. I'm the president of the Lundy Foundation, which supports the building of collaborative leadership and the strengthening of capacity of nonprofit organizations. I was also the CEO of an executive jet leasing company, and I also consulted in the aviation industry on equity financing, leveraged buyouts, and negotiating corporate acquisitions. I'm also the director of this evaluation, even though I entered initially as a consultant to Africa Bridge, and this is the nonprofit organization that facilitated the village planning process for the Children's Center. And after becoming involved in the evaluation, I also helped to obtain the funding for the building of the center and also for the evaluation itself. And now I want to take an opportunity to introduce my partner, Mr. Alan Wallace.
I was the co-principal investigator who had responsibilities for the overall research design and report. I was most involved in the analysis of the social and economic sustainability aspects of the evaluation. I'm an associate professor of public policy with the School of Public Affairs at the University of Colorado's downtown Denver campus. I have conducted research on housing and regional planning in the United States and teach courses on urban social problems, urban politics, and growth management. I also facilitated the development of a comprehensive HIV/AIDS service plan for the state of Colorado and the Denver metropolitan area. Now I'd like to discuss how we both became involved in the project.
I was asked by Africa Bridge to do some executive coaching on how to set up nonprofits, writing grants, and approach funding sources. And after working on this, I was approached to examine the problems created in Tanzania by HIV and AIDS in a small village there. And I actually met with Brian William, who's a senior researcher from the World Health Organization. And he told me there was virtually no systematic evaluation of support for HIV and AIDS orphans. I was really moved by this, and I decided to do something in regards to this lack of knowledge.
I also became involved with the project early on as the center was being completed, and Victor began considering approaching the Rockefeller Foundation for the evaluation. I wrote a brief concept paper on how the evaluation might be designed and conducted, and was picked to be as part of the team.
So now we're going to talk a little bit about the Children's Center, which is Godfrey's Children's Center located in Ndwele, Tanzania.
Godfrey's Children's Center is a nonprofit organization that was created to follow the dreams of Godfrey Sesmwa. He was raised in Idlewild, and him and his brother wanted to do something to help the orphans there. The Children's Center was a project designed to serve some of the most needy orphans to a village consisting of about 2,500 people. This village was severely affected by AIDS, HIV, and caused about 40% of the children in Idlewild to be orphans. Godfrey passed away before the center could be created, but his friends started this nonprofit organization to pursue his goals. The center was created to be a place where the neediest orphans of Idlewild could live, be cared for, and be educated. The center is supposed to be a hybrid institution where children could live in a dormitory-type setting, but would remain in their village of origin, where they would be cared for by people hired from the village, attend the village school, visit with family, and remain integrated with village life. This center also serves other children in the village by offering preschool and after-school programs. 58 orphans were selected specifically to live at this center.
And what we'd like to do right now is go ahead and show you a short video on Godfrey's Children's Center. It's a very long video, but we're only going to show you just a couple minutes worth to give you an idea of the center.
This young child had spent much of her young life in grief. Here in Idweli village near Mbeya in southwestern Tanzania, hundreds of children have lived their short lives in poverty and desperation. Many of them are orphans as they've lost their parents to one of the deadliest diseases in recent history, namely HIV/AIDS.
This village is one of the villages in our region which has got more orphans comparatively, because there is a highway passing through it to Malawi, and you find a lot of these villages where the road passes. Research show that there are more incidences of AIDS impact than areas which are even more remote. And again, if you remember, in the year 2001, there was an oil fire accident right at the village where up to 40 adults died. So they left a lot of orphans. So we had to start at least with that village because the problem was even alarming.
But life has now changed for these children as there is a new fountain of hope in the form of shelter, care, and love. And it was the initiative of a group of young men guided by the passion of Dr. Godfrey that led to the creation of a children's center where orphaned and vulnerable children can be housed, fed, and provided with basic healthcare services, preschool education, and recreational opportunities. This dream was realized in June 2005 when Godfrey's Children's Center was inaugurated by the Charge d'Affaires of the United States Embassy, Michael Owen.
Now we are going to discuss the evaluation approach.
So we're going to talk about the evaluation itself. The evaluation was meant to compare children living with relatives with children living with their parents on key measures of physical well-being and psychosocial development. The evaluation uses a mix of quantitative and standardized measures. We used a more participant-oriented approach during the planning and preparation phases, and then we shift to more of an expertise-oriented approach during the actual implementation phase. The evaluation also collected information to assess village support and involvement in the center to examine its sustainability.
Now, Dr. Decay, were quantitative and qualitative methods used?
My team came up with a number of qualitative and quantitative measures to assess the children's physical as well as their mental health. In addition to collecting data, interviews were conducted with all the children and with their caregivers regarding physical and psychosocial well-being and the sources of support.
And what approach did you state in terms of the evaluation?
I created a team of 13 people, 7 from Tanzania and 6 from the US, who all had expertise in children's mental and physical health, sociology, anthropology, community development, and communication. And the evaluation was really created with 3 elements in mind. We wanted to understand changes in the children's physical well-being, changes in their psychosocial development, and also the socioeconomic sustainability of the center itself.
What pre and post measures were used in the evaluation approach?
Unfortunately, pre and post measures could not be used because the center was already operating for about 8 months before we began collecting data. The evaluation that was completed, though, focused on 3 comparison groups: orphans living in the children's center, orphans cared for in the village, and non-orphans in the village, which equated to approximately 209 children. So in regards to the evaluation approach that we used, I really want to clarify most of this evaluation was expertise oriented because of the experts panels involved, and that occurred mostly during the implementation phase. We did utilize stakeholders in the planning process, so we viewed that as participant oriented, but mostly just during the planning and preparation phases. So, Dr. Wallace, can you talk a little bit about the evaluation questions and what were the questions that the study answered?
The evaluation questions were formed based on Rockefeller Foundation's own interest in measuring the psychosocial well-being of orphaned and vulnerable children. Together, we both had the desires to develop an evaluation protocol that could be used by other organizations that work with orphaned and vulnerable children. The questions we originally addressed were, does the center work? And if so, what does it say about developing similar hybrid situations like this one?
And I just kind of want to throw in here, although the Rockefeller Foundation had their own questions, I really wanted to do an evaluation that would be able to be used in other contexts so that we could really influence even more children, more orphans.
So, early on, we collected information that the team thought of, okay? And this was based on 3 overarching areas, so psychosocial, physical, and socioeconomic. We collected the standardized testing information as well as interviews from the children. We collected information on physical health, psychosocial measures, coping skills, school attendance, and performance on school-based tests.
We also developed focus group protocols, which formed a divide between those that wanted to have data on everything and those wanting less, but to make sure that what we got was good.
Now, Dr. Decay, did you run into any issues with the information collected from the interviews?
Yeah, there were a couple things. First, we do not have any empirical evidence for what happened, but based on my observations, I think the training was not sufficient for field workers. The training was originally designed to include practice with children, but that never actually happened. We sort of ran out of time. And the field trainers weren't trained as well as they should have been in interview techniques. And I believe that the children had a desire to please the interviewer, but our interest was the qualitative measures in comparison groups. Dr. Wallace, maybe you can take an opportunity to talk about design sources and methods we used.
The team worked in the United States on a preliminary selection of instruments that we thought would work in the field. We brought a huge notebook of possible instruments, and then we worked a while together in Dar es Salaam before going into the village. After going to Idlewild, we realized that we needed to do some ethnographic work.
And I wanted to use some standardized measurements, ones that had established reliability and validity. And we decided as a team to triangulate those measures with data gathered through more qualitative and exploratory methods, including interviews with the children. We were very concerned with using these measures in a different culture. So we relied extensively on our Tanzanian colleagues to review the instruments themselves and to have them give us feedback on whether or not it would work. And after working together, we did some pilot testing to see if they were capable in giving responses. In regards to completing the evaluation and the actual results, we had a little bit of an interesting situation. Rockefeller Foundation was our primary sponsor for this evaluation, and they had some pretty strict requirements in regards to the information as the evaluation was taking place. So in regards to the Rockefeller Foundation, they were getting a lot of our results of our studies and our questions and our interviews as the evaluation took place. So that's why they were getting formative information. All of our other stakeholders were required by the foundation to have access to the results after the completion of the evaluation itself. So that's why you see that our stakeholders here were more involved in the summative findings of the evaluations. The primary purpose of our findings truly were to influence policy, but also to provide templates for future evaluations for other contextual situations in children and orphans. One of the things that I do wish we collected in regards to data, I really wish we'd collected data on the number of times that extended family members visited the center. If this had been done, I think there would have been much more buy-in for the locals. Dr. Wallace, can you explain a little bit, how did qualitative methods give us valuable data for the evaluation?
I believe the most valuable data came from the focus groups and the interviews with people who participated in the process of identifying the need for a center and developing it. We do argue in our report that while Idlewild appears to be successful, the center may not work everywhere.
And I'd like to say that qualitative results also indicate that many children are envious of the center orphans. It's very difficult to balance providing the center orphans with care and support to improve their lives, given the norms of the village. And it's very hard to give the kids at the center what they need, keeping them healthy and learning so they're not pulled down by the rest of the kids in the village, but also not segregating them either. We'd kind of like to end our discussion today talking about what we learned and how it fits within the context of this course. Dr. Wallace, would you like to start?
Current literature is very strongly against orphanages. But from our perspective, the Idlewild Center isn't an orphanage in the traditional sense, but instead an institution of and for the village. I believe it makes this center a hybrid of something between an institution and an extended family placement.
And I'd like to just kind of sum up and say that in addition to the results from the evaluation, we really learned a lot about the cultural differences in the process of actual disseminating the results.